Most TherapyNotes alternatives get evaluated too late, after a group practice has already committed, then decides to open an IOP and discovers the software can't follow. Picking software that can't grow with you means rethinking your entire system in the middle of the transition, exactly when you can least afford it. Here is what a Behave Health demo actually shows you, and how the Get Started path works for a growing behavioral health practice. We cover what the live walkthrough covers, how data migration works, the onboarding support included, and how Parallel Go Live protects your operations. A Behave Health demo is a live walkthrough tailored to your facility type and size, not a generic product tour. The walkthrough is shaped around your organization, so you see the workflows that actually matter for how you operate. It shows how the platform handles admissions, clinical documentation, billing, and day-to-day operations end-to-end. When a group practice expands into IOP, the billing form changes. You move from CMS 1500 professional claims to UB04 facility claims. Software built only for solo care can leave you stranded. Open an institutional facility, and you often need UB04 claim forms instead of CMS 1500, the forms required for facility billing. If the forms you need for IOP billing aren't there, you're forced to re-platform during the exact moment your operations and revenue cycle are most fragile. Behave Health is designed to support practice growth, so you can open outpatient or IOP programs without changing software first. Behave Health supports UB04 facility claims, group notes, and integrated revenue cycle management, the workflows facility-based care depends on. It is built for the collaboration-heavy, multi-provider workflows typical of IOP, not patient records siloed around a single clinician. When you book a demo, here are 4 areas worth asking your product specialist to walk through, the ones that decide fit for a growing practice. These 4 map to the end-to-end flow the demo is designed to show. Let's walk through each. First, ask to see admissions and the dedicated admissions CRM. A dedicated admissions CRM with lead tracking is one of the reasons practices explore alternatives. See how leads move into admissions. Watch how a prospect flows from the admissions CRM into clinical documentation in the same platform. Second, ask to see clinical documentation, including group notes. Group therapy note workflows with attendance tracking matter for IOP, where programs often hinge on group therapy. See how multiple providers collaborate on a shared record rather than working in isolated, single clinician silos. Third, ask to see billing, specifically UB04 facility claims and integrated revenue cycle management. Watch a UB04 facility claim move through the platform, since this is the form IOP and facility-based billing depend on. See how revenue cycle management is integrated across providers rather than bolted on as a separate tool. Fourth, ask to see the operational tools that live in the same platform as the EHR. All-in-one operational tools, property management, vehicle tracking, maintenance scheduling, sit alongside the EHR instead of in separate systems. Behave Health provides mobile responsive access for clinicians, admissions staff, and patients across these workflows. If you're evaluating whether to stay or switch, Behave Health provides a structured migration path designed to protect your operations and revenue cycle. The team handles data migration, so your records move over without you rebuilding everything by hand. Onboarding includes staff training across CRM and admissions, EHR documentation, and RCM billing workflows. Parallel Go Live support is designed so the transition does not disrupt your operations or revenue cycle. Behave Health's all-in-one app puts clinical, administration, staff, admissions, alumni, residents, treatment plans, billing, and insurance authorizations in one place. Built as an all-in-one platform, it is designed to minimize the need for external integrations across your workflows. Onboarding support and ongoing training are offered across customer tiers, from admissions through documentation and billing. Getting started? Your product specialist can also point you toward resources for licensing or accreditation by the Joint Commission or CARF. Stop rebuying software every time you grow. Book a demo of the all-in-one platform at behavehealth.com. See admissions, group notes, UB04 billing, and migration support in a walkthrough built for your facility at behavehealth.com.